am very pleased to welcome you to the 2017 Health Equity Design Strategy Session. We're kicking off the next 3 days of events with our Health Equity Design Session, otherwise known as what we call using our acronyms, the ARC Head Lab. The Head Lab's Health Equity Design Labs, HED, convene thought leaders and community stakeholders to build consensus and incubate the best ideas that promote equity in key policy and program areas ripe for intervention and innovation. Many of you, or some of you, have attended our past HED Labs and know that together we can vet and design a variety of best practices, recommendations, and innovative solutions that can be deployed by policymakers in the field at large to advance social change. Our Head Lab 1 focused on challenges and best practices in advancing health equity. Some of you were participants in that. We focused broadly on how to address health equity and the social determinants of health. At our Head Lab 2, we focused on Mind the Gaps, gender pay equity, and the implications of health equity. And it became clear from that session that we needed to further expand our analytical lens and include the wealth gap. Where's Heather McCullough? What's the name of your organization? Closing the Women's Wealth Gap. That it was too narrow to focus on pay. We had to focus on wealth at the intersection of health in order to really have the lens that we needed to have to really address this issue in a way that I think will be resonant but also transformative. Our 2017 Women's Wealth and Health Equity Summit was born out of that desire to see women lead healthy and financially stable lives. And today, our today's Head Lab will explore the causes and the consequences of gender-based pay and wealth inequities and how they intersect and impact the health and economic well-being of women, children, families, and the economy. There is an inextricable link between a woman's wealth and her health. But that connection is not always apparent to society, which is just dumbfounding and confounding, and that's why we're here today. Persistent gender-biased systems have created a wealth gap that has left women with just 32 cents of wealth for every dollar of wealth owned by men. And women of color have even less. In fact, when you look at it by gender and by marital status, women of color are at the zero line almost, meaning that many of them have negative wealth or in debt. And since women comprise 47% of the US workforce, when women are sick, our economy is sick too. And not only that, but how many of you know, actually I'm gonna do a little experiment. What percentage of the purchases do women make in our economy? Can anybody give me an answer? 90? 75? It's actually 85. 85% of the purchases made in the U.S. economy are made by women. Just digest that. Think about that. This economy would not go around without women. And yet we face persistent disparities in pay, in treatment, in wealth, in health, and it is simply unacceptable that we're driving this U.S. economy, and yet we're treated like second-class citizens in many respects. The status quo cannot be maintained. The wealth gap, the pay gap, the health gap, and the equity gap are all problems that can be solved. So let's get about doing it. We're looking forward to an exciting few days of discussions, panels, and breakout sessions on the topics of wealth and health, and particularly how these topics affect women of color, families, and the U.S. economy. We will discuss women's wealth and health, community engagement, and how to build stability for women who work. Starting tomorrow, we will have an interactive exhibit called Undesign the Red Line, where we will explore the history of structural inequalities and invent strategies for undoing those structural inequalities. We will think intersectionally and through the lens of intersectionality and across silos. We will work together, we will learn together, and we will problem solve together. Today will be interspersed with breakout sessions and 2 moderated panels, Health and Wealth Equity, Where We Stand Today, and new approaches to community and stakeholder engagement. Both panels will be moderated by our partners at Thicket Labs. And actually, I want to acknowledge our Thicket Labs team, led by Deepthi in the back, black and white. Raise your hand. And the rest of the Thicket Labs team, wave your hand. They will be helping to moderate the entirety of our summit sessions. So they'll be all around. I also want to acknowledge the team at the Center for Global Policy Solutions. Where is Elise and Ashley and everybody else? Please stand, everybody, please stand. Wave. I think some folks are outside. And of course, we always want to acknowledge Beyond Ideas Group with Antonio White in the back. He is our event planner for this event. And this evening, we will urge you to join us for dinner so that we can continue our conversation on women's health and wealth. So with that, I'm going to turn it over to Deepthi to take over. Deepthi?